How's it, guys, and welcome back to I Bet You Didn't Know. Today we're going to cover 3 things about CPR that I bet you didn't know. And you might think straight away, he's probably going to talk about head-up CPR. I'm not. You probably know about that already. So the first one we're going to address is Intracorporeal Abdominal Compression, so IAC. So what that is that when we do chest compressions on the abdomen and on the chest. So we do abdomen, chest, abdomen, chest, abdomen, chest. What this does is it increases the arterial blood flow because we're pushing on the aorta that's in the abdomen, and then we're pushing on the heart. The studies that have been done are limited to pigs, but they did find that it doubled the arterial pressure in these pigs. Studies on humans is quite limited because of ethical concerns. I'm not sure if it has been looked at since then, but it would be interesting if you guys know more. Maybe you've done it, maybe you've seen it, maybe you know more than I do. Would love for you to share. I haven't ever seen it or done it, and please, I'm not saying go do it, but it is something that has been done or looked at, so interesting. The next one is prone CPR. So let's say you get to a patient's lying on their stomach, face down, their legs are trapped under a car and they're in cardiac arrest. How do you do CPR on someone who's lying on their abdomen? Prone CPR. So we push in the same place, well, obviously on their spine, at the same depth, at the same rate, and what we're doing is we are compressing the spine and the sternum together, which then squeezes the heart. And they found that this is just as effective as normal CPR, actually improving their ventilation because the lungs are then hanging forward, kind of like in COVID when we then proned people who were being ventilated to assist in their ventilation. So prone CPR is a thing. So you can do chest compressions on someone's back. And then the last one is something called Cough CPR. And yes, it's not exactly CPR. And the AHA and the UK resus guidelines did put out a statement about Cough CPR not being CPR. I agree, it isn't actually chest compressions, but it does cause blood flow because we are increasing the pressure in the thorax, which then pushes blood out of our heart. It technically pushes blood forwards, but it obviously is not as effective as a chest compression. So we can't, substitute coughing for chest compression. Please don't do that. But where may this come in handy? So if you are in a cath lab and the patient, goes into runs a VT or whatever the case is, then you could get them to cough, which could generate some blood flow while we wait or while we fix that problem. The place where, and maybe a paramedic is going to more likely use this is actually when we're giving adenosine. So if someone has an SVT or a VT or whatever the case is, and we're giving them adenosine to try to fix this fast heart rate, by getting them to do cough CPR, or just to get them to forcefully cough, we do 2 things. One is we distract them so that they're not thinking about their heart stopping for a brief period of time, but we also are generating blood flow. So if their asystole is protracted, so if the asystole lasts for too long, by getting them to cough, we're actually generating a bit of a blood pressure, which hopefully generates a bit more consciousness while we wait for that asystole to stop and go back into a normal sinus rhythm. So that's where Cough CPR would be appropriate. Please tell me if you've ever heard about this or done this. If you are liking this series, please let me know in the comments. Please hit like and share and subscribe. If you do like this, I'm going to keep on making this series. It means I'm going to have to keep on digging and finding new things to talk about, but that's great. That's what I love about this. So guys, thanks for your time.